This week on Full Circle Florida, deny, defend, depose, and the anger aimed at the system. The assassination of the United Healthcare CEO, exposing the uncomfortable truth many Americans are now facing. The rising cost of health insurance, the rising denial of benefits. Is it happening more often? If so, why? And what, if anything, is Washington prepared to do about it? This week, my featured conversation with healthcare expert and whistleblower, Dr. Bryan Ardis. You won't agree with everything he has to say, but it's a touchy topic, and we're tackling it this week. Plus, we're getting your voice on your healthcare. Health insurance. Are you happy with your health insurance?
Funny enough, honestly, I don't have any right now.
Why not?
The health insurance I had, it really wasn't covered at a lot of different places and stuff like that. So, and I'm self-employed, so I haven't done it yet.
What you told me. And it's been a long December, and there's reason to believe it will be a busy March. This week, I speak with our Capitol reporter, Forrest Saunders, on the big priorities Florida lawmakers will move on next year, from property insurance to guns to tuition for children of immigrants. How much of it is politics and how much of it is about you? Welcome to Full Circle Florida. Was the gunman who killed the CEO of United Healthcare a freedom fighter, an anti-hero who exposed the inequality of the healthcare industry that many say is feeding off of hardworking Americans, denying them coverage to life-saving care while it rakes in record profits year after year? Or was he just an American spoiled brat who got radicalized on the internet with too much access to social media and easy access to guns and ammo to take out the target of his rage? It's an edgy question to an edgy topic, and this week we have an edgy guest. Full disclaimer, you may not agree with everything he has to say, but he has a lot to say. Here's my conversation with healthcare whistleblower Dr. Bryan Ardis.
The suspect approached from behind.
I think a lot of people obviously are talking about this after what happened, and no matter, obviously a lot of people don't condone the violence, but it opened up the discussion and the question, are insurance companies denying claims at a higher rate than they used to? And if they are doing that, why? What has changed in the past 10 to 20 years?
Yeah, it's a great question. Great question. So the answer is denials and delays on insurance claims for all things medical or alternative has been a long-standing concern. It has been a long-standing frustration for every clinician, every medical doctor, chiropractor, dentist who files medical insurance claims to get paid. They often find themselves having to hire full-time staff just to write and produce the appeal documents to all health insurance companies to try to get paid for the services they've already provided to their patients. United Healthcare has historically had one of the worst denial percentages, actually twice as high as the industry standard for at least the last 10 years. It has been estimated 32% of all United Healthcare claims are immediately denied, which just creates delays. So anybody out there who's acting shocked by this, how many times have you ever heard personally someone went to their medical doctor, paid in their copay, turned over their insurance card, were given a prescription, went to the pharmacy to get that prescription filled, only to hear the pharmacist say over the counter to the patient, "I'm sorry, but your insurance has denied coverage for your prescription."
Just navigating the system itself, I think takes way more time than people have, especially working people, just trying to figure it out. And you never know up front what something is going to cost you. If you, God forbid, have to go to a hospital, there's always this big mystery about what's this really going to look like 3 months down the road when I get the bill, and what do I really owe? It's just a lot of confusion.
It is a massive amount of confusion. You are correct. And yes, far too often, medical procedures, medical prescriptions that are supposed to be life-saving, disease-riddening, or reducing are being denied by health insurance companies.
Bottom line, do you think that there's enough public outrage after what happened with this latest situation to pressure Washington to make any kind of change with this new incoming administrations? Or do you think that this is really just a web of money? There's too many people who have too much to gain with the system being set up the way it is, and hardworking Americans are essentially caught in the middle?
Yeah, that's a great point to consider. Everybody should be excited about what's happening. The the concerns, the voiced frustration, doubt in all things medical, including vaccine agendas right now, healthcare systems. I'm not sure if your audience is aware, everyone listening, the Journal for American Medical Association just published in the summer of 2024, just a few months before Bryan Thompson is murdered. They just reported that healthcare workers in America, hospital staff, they actually surveyed 500,000 of them. Do you know that only 40% of them, actually only 40% are getting current flu vaccines this season, and only 17% or less are actually admitting they're up to date on COVID-19 boosters? This is important. There is a massive upset and concern around healthcare in America, and it is spilling over even inside the healthcare industry. There is less faith in science, less faith in medicine than ever before, and don't overlook why this is happening. The whole reason for these upsets, the reason why it's in the mainstream media, is because the medical health system, the pharmaceutical industrial complex, literally tried to rob all Americans of all freedoms the Constitution provided them for the last 400 years, underneath mandates and lockdowns proposed during the COVID-19 pandemic. Big Pharma is in control, and they literally control. They create the diseases using medications, vaccines in children. I'm not joking. And then they sell you drugs, but then want to deny coverage from the insurance companies that they also lobby and control. So there is a massive amount of bureaucracy that overrides all frustrations in healthcare. And yes, unfortunately, the lay people are left to pay all the premiums, the high cost deductibles that go up one year after another. And you're seeing more and more insurance companies find ways to deny those medical procedures they are there to bless you with, that you're paying for. So it is a very frustrating thing, but I'm really hopeful that this next administration over the next 4 years, if they hold to their creed and mandates, they will find ways to reduce the denials, the delays, and then payouts for what was pushed on everybody in America, a racket of health insurance that you never saw before underneath Obama's administration with Obamacare. More people were forced to carry health insurance, more denials and delays have come ever since, and it has been a massive, massive upset for many, many Americans.
Well, it's a complicated problem that's certainly back in the public discourse, and was sort of the scab was ripped off of it in the most disturbing of ways. And I don't think anyone really condones how this happened, but people are certainly taking a look at it. Dr. Ardis, thank you for your time and your insight. Much appreciated. Thank you. Next on Full Circle Florida, your voice on your healthcare.